Welcome to the Nurse Perspective, where we delve into the vital intersection of healthcare, community, and public health nursing practices. In each episode, we'll explore a wide range of topics, from preventative care and health promotion to disease management and community engagement. We'll have special guests talking about specific topics near and dear to their hearts, and individuals with lived experiences, shedding light on the challenges and successes of public health. Let's meet the team, starting with your host.
Hello, my name is Jackie Haley, RN, and I'm the Clinical Section Manager at Two Rivers Public Health Department, and I oversee nursing and all things clinical.
Hello, my name is Jordan Anderson. I am an RN, a community health nurse, and I am in charge of the STI program and the VFC-VFA programs.
Hi, I'm Rosa with Two Rivers Public Health Department. I am an LPN and I am a disease investigator, and also I am your local TV nurse for our jurisdiction. And I also speak fluent in Spanish, so if you need our assistance, feel free to call.
Hi, my name is Liz Weens. I'm a community health nurse at Two Rivers Public Health Department. One of the main roles I fill is I am the lead nurse for lead investigations in our jurisdiction.
My name is Marilyn Warnken. I'm an LPN. I am a program nurse at Two Rivers Public Health Department. I am in charge of immunizations, and also I do poop.
Whether you're a seasoned public health nurse, a healthcare professional, a student aspiring to enter the field, or simply interested in learning more about the critical role of nursing in public health, this podcast is for you.
So there have been a couple health alerts for Nebraska DHHS here in the last month. The first one is titled Adverse Effects Linked to Counterfeit or Mishandled Botulinum Toxin or Botox Injections. The CDC, the U.S. Food and Drug Administration, and state and local partners are investigating clusters of 22 people in 11 U.S. states reporting adverse effects after receiving injections with counterfeit Botox or injections administered by unlicensed or untrained individuals or in non-healthcare settings such as homes or spas. The second one has to do with Lyme disease in Nebraska. So on average, Nebraska reports 7.6 cases per year to the CDC, and Nebraska is in a zone where the tick vector appears to be expanding further. Providers suspecting Lyme disease must be vigilant and obtain thorough patient histories, including travel in the 30 days prior to symptom onset, reported tick attachments and bites, reported exposure to tick habitat, including tall grass or wooded areas, and also providers should take great care to order the correct serologic tests in the correct order. Mental Health Awareness Month is celebrated yearly in May. Since its inception in 1949, Mental Health Awareness Month has been a cornerstone of addressing the challenges faced by millions of Americans living with mental health conditions. Haley Yelnick, health educator with Two Rivers, is here to chat with us about the importance of mental health. Thanks for joining me today, Haley. Why is this month so important?
Hi. Once again, I'm Haley. I'm a health educator here at Two Rivers Public Health Department, and part of my job is to talk to people about mental health, behavioral health, and overdoses. You may not always notice it, but your mental health has a big impact on your well-being, your physical health, your self-esteem, your self-worth, how you socialize with other people, the way you find meaning and worth and your value in your life. The psychological functioning is tied also to your memory, your problem solving abilities, your whole physical well-being. It's a strange phenomenon, I guess, because it can affect every part of your body and your mind.
Crazy. Seriously. Do you have any statistics specific to our area or even Nebraska about mental health?
Yeah, Dr. Marley Doyle, that's the director of the Behavioral Health Education Center for the Nebraska. It's at the University Med Center. Said that 88 out of our 93 counties are considered mental health professional shortage areas.
Oh my goodness.
That blew my mind.
That is, yeah.
How would that be that so many of our counties don't have what we need?
Yeah.
It's a sad situation. Nebraska has only 48% of the needed behavioral health professionals or providers. That's according to the U.S. Health Resources and Service Administration.
Wow, that's just nuts considering that it's such a crisis. You would hope and think that more doctors and stuff would be wanting to get out to these areas and help the cause.
They are doing through the colleges, it's called Beacon. And
Okay.
unfortunately, I can't remember what that stands
That's
for.
okay.
But it is about getting more mental health providers through UNK.
Awesome. So like with through scholarships and stuff and
Yes.
awesome. Okay, so hopefully maybe that number, the
Will go
percentage will
up.
go up. Yeah.
Yeah, we
hopefully.
really hope that
Fingers
that
crossed.
does happen. Exactly.
Fingers crossed. That would be great, right?
I do want to say I'm not sure about the scholarships or not, but that's really something to look into. Maybe on the website for UNK.
Yeah, for sure. I know they offer scholarships if you're going to do like rural. So if they don't already have some, they should get some for mental health if it's such a need for sure. Well, moving on then, what is Two Rivers doing to help support the mental health crisis in our area? I know you kind of said a little bit about what you do, but do you want to go into specifics at all?
Sure. We post mental health tips on our social media. The other really cool thing is we just launched on May 1st a website called Credible Mind.
Mm-hmm.
And that website rocks. It has got assessments on it that you can, if you think, oh, maybe I am depressed or maybe I have anxiety, you can go on the website, you can take an assessment, and that it helps tell you what your next step should be. Like, maybe I need to see a therapist, or maybe I need medication and need to see a psychiatrist. We can't say that website is, that it doesn't replace going to your doctor.
Yes, it won't diagnose you.
No, but it gives you places to go.
Yeah.
Right now, we are in the process of adding resources to our page. One thing that I love is we are adding, it's called, I believe it's Therapists of Color.
Okay.
So you can go on there, and if you're needing somebody that is multilingual, bilingual, you can go on there and it'll tell you, I do telehealth and I talk Spanish, or I do telehealth and I do things on racial lines.
Okay.
So it's a wonderful program.
Wow.
Most of those providers are from the Omaha area, but they all provide telehealth, and that rocks.
That is so amazing.
Exactly. So we're just continually adding to that.
That
so something
is
to look
awesome.
into.
Yeah, and they can reach that site just going to trphd.ne.gov. It's right there on our homepage, right?
Yes. Okay. Also, you can do trphd.crediblemmind.com.
Okay, perfect.
And get right to it.
Well, there you go. Awesome. Well, that is a lot of great information, Haley. I even learned some new things. So I appreciate your time today, and thanks for joining me. Is there anything else you wanted to add?
All right. Well, thanks, Jordan. Now we're going to move into National Skin Cancer Awareness Month. And I have Marilyn Warnkin. Hi, Marilyn. How are you today?
I'm good, thanks.
Good. So we are going to give some updates and just education about skin cancer. So what can you tell me about skin cancer, Marilyn?
Skin cancer is fairly common around Nebraska just because we spend a lot of time outside. So you want to make sure you're watching your moles and stuff just to make sure they aren't changing. And
if they are?
Things to look for. Asymmetry, you want to make sure that your moles look alike on both sides. So if you cut them down the middle, is one worse looking than the other side? That is something you want to have checked with your doctor. If the border is irregular, scalloped, that is a sign of melanoma. Color, you want to, most moles are just your brown, but if it's got some darker browns, uneven colors, even some black, some blue, sometimes red in it, that is a concern for melanoma. The diameter, most moles are not larger than the size of a pencil eraser. So if it's bigger than that, that is something you want to see your doctor about. if it's changing and you're having new symptoms, if it's itching, if it's burning, if it's bleeding, if it's scabbing over and then like it heals and then it comes back, that is something to be concerned about. And then there's the ugly duckling sign. That is if you have a mole that doesn't look like your other moles, or a mole that's in a place where there are no other moles. That is something to be concerned about.
Cool. I mean, not cool, but good information to know.
Thank you.
So can you tell us what's the best ways to look at your body and identify these things?
Yes, you just want to go from head to toe, so you examine your face, especially your nose, lips, mouth, and ears. Those are all areas that you can get skin cancers. Make sure you're looking at the front and the back of your ears. Have somebody look at your scalp. Maybe your hairdresser could do that for you, or spouse or whatever. Check your hands, your palms, in between your finger, under your fingernails, and then continue both sides of your arms, upper arms, lower arms. Inspect your neck, your chest, your torso, lift up your breasts to view underneath, your back of your neck, shoulders, upper back, your lower back, buttocks and backs of both legs, genitals, front and back of both thighs to shins, ankles and feet, including your soles, your toes, between your toes, your nails. Usually melanoma is seen on males on their backs and females usually on their legs, but it can appear anywhere.
Interesting. Oh, all right. Awesome. Well, thank you so much for joining us,
All right,
Marilyn.
thank you.
Thanks for joining us. Check back in with us next time for more of the Nurse Perspective.